Feeding tube for infants, conditions, procedure, and risks. Feeding is a critical aspect of a baby's development, but sometimes, infants face difficulties in consuming food through the mouth. In such cases, a feeding tube might be recommended. A feeding tube is a slender, flexible tube inserted through the nose or mouth into the stomach or small intestine. It provides a way to deliver nutrition and fluids directly to the infant's digestive system. There are certain conditions that may necessitate the use of a feeding tube for infants. One common condition is premature birth, where the baby may not have developed the reflexes needed for successful oral feeding. Premature infants often struggle to coordinate their sucking, swallowing, and breathing, making it challenging to take in enough nutrition. Another condition that might warrant the use of a feeding tube is neonatal cardiac disease. Infants with heart conditions may have difficulty feeding due to low energy levels or inadequate blood flow to the digestive organs. Similarly, conditions like cleft lip or palate can interfere with a baby's ability to latch onto the breast or bottle. The procedure for inserting a feeding tube in infants is relatively straightforward, but it requires specialized medical attention. Typically, a pediatrician, neonatologist, or other trained healthcare professional will perform the procedure. Before the insertion, the baby's nose or mouth is numbed using a local anesthetic. Then, a small, flexible tube is inserted gently into the nostril or mouth and guided down the esophagus into the stomach or small intestine. An X-ray may be taken to ensure the tube is positioned correctly. Once in place, food, breast milk, or formula can be delivered through the tube using a syringe or feeding pump. While a feeding tube can be a lifeline for infants struggling to eat, it is essential to be aware of the potential risks and complications. Infection is a primary concern when using a feeding tube. There is always a risk of introducing bacteria into the baby's digestive system, which can lead to infection. Proper hygiene and regular cleaning of the tube are crucial to minimize this risk. Another potential complication is tube displacement. The tube may accidentally slip out of position or become dislodged, requiring immediate medical attention. Additionally, there is a small risk of damage to the baby's nose, throat, or esophagus during the insertion process, although this is rare when performed by an experienced healthcare professional. Despite these risks, the benefits of using a feeding tube for infants are significant. It ensures adequate nutrition and hydration, allowing babies to grow and develop properly. It also offers a solution for parents who may struggle with the emotional toll of a baby who cannot feed effectively. Moreover, using a feeding tube can help prevent the potential consequences of malnutrition, such as delayed growth or developmental delays. In some cases, the use of a feeding tube may be temporary, as infants gain the necessary skills to feed orally. With proper guidance and therapy, many infants can eventually transition to oral feeding. However, each baby's situation is unique, and the duration of feeding tube use can vary widely. In conclusion, a feeding tube can be a vital tool for infants facing difficulties in oral feeding. Conditions like premature birth, cardiac disease, or cleft lip, palate may necessitate the use of a feeding tube. The procedure involves gently inserting a flexible tube through the nose or mouth into the stomach or small intestine. While there are potential risks and complications, the benefits of improved nutrition and hydration for the baby outweigh them. It is important for parents to work closely with healthcare professionals to ensure proper care and monitoring during the use of a feeding tube.